All right, let's jump right in. Today, we're going to be talking about a powerful but honestly often overlooked branch of traditional Chinese medicine. It's a field with some seriously ancient roots that could totally change how you think about what TCM can do.
No, really, just take a second. When you hear the words traditional Chinese medicine, what's the very first picture that pops into your head? For most people, it's probably one of two things. And yeah, that makes total sense, right? In the West, our main exposure to Chinese medicine is through acupuncture needles and those herbal formulas we drink as teas. And look, those are incredibly important, but they're only one piece of a much, much bigger puzzle.
But what if I told you that focusing only on those methods is like trying to understand a book by only reading the even-numbered pages? There's this entire other discipline that's all about treating the body from the outside. This is what's known as external medicine. And here's the really wild part. Even a lot of Western practitioners of Chinese medicine have a surprisingly limited appreciation for this field. So you know what? Let's fix that right now.
Okay, so the very first thing we have to do is clear up a huge misconception. It all comes down to a really, really common translation error when people hear the Chinese term for this practice. The term is YK. And while, yes, historically it did involve things like lancing and draining abscesses, calling it surgery is just, well, it's like calling all of Western medicine taking Advil. It completely misses the point and the massive scope of what's really going on here. Now, this slide really shows you what I'm talking about. Look at that contrast. On the left, we've got the Western idea of surgery, a very specific, usually invasive procedure. But then look at YK on the right. Whoa! It's not just one thing. It's a whole collection of specialties. It's dermatology, it's trauma medicine, it's treating masses and tumors, and yeah, even proctology and andrology. It's a completely different way of looking at things. And don't think for a second that this is some new age invention. Nope. External medicine has roots that go back thousands of years, making it one of the original medical specialties. I mean, we're talking way, way back in the Zhou dynasty. Court physicians called Yang-yi, which literally means sword doctors, were the specialists in this field. They treated everything from ulcers to injuries people got from weapons. And over the centuries, these techniques were sharpened, woven into the broader theories of internal medicine, and evolved into the incredible practice we see today. So, what does this stuff actually look like in practice? What's in the toolbox? It is way more diverse than you might think. The toolkit for an external medicine practitioner is just massive. We're talking about everything from simple water-based washes and oil-based ointments, all the way to medicated powders, suppositories, and even a technique called wicking, which uses medicated gauze inside of a wound. Let's just take a simple medicinal wash as an example. The process is really quite straightforward. You decoct herbs in water, kind of like making a tea, but usually not quite as strong. Then you soak a cloth in that warm medicinal liquid, and then you just apply it to the area as a compress. Sometimes it even gets wrapped up to seal in that humidity and really help the medicine penetrate the skin. And it gets even more interesting. You've got practitioners creating these amazing oil-based ointments by simmering herbs in a slow cooker for hours. Or, and this one is really wild, they might apply finely ground herbal powders right into a patient's navel, form a paste, and then seal it for days at a time to treat deeper constitutional issues. Okay, so now that we've seen the how, we really need to understand the why. A lot of external medicine works on a therapeutic principle that can feel, well, a little intense, especially to us in the West. This quote from the source material really just hits the nail on the head. There's this tendency for people to get intimidated by what are called attacking formulas. But getting past that fear is absolutely key to understanding the power of this approach. So this brings us to a really important distinction: attacking versus supplementing. Supplementing is what we're probably more familiar with. It's about nourishing a deficiency. But attacking is all about getting rid of the pathogen, the evil qi, first. The idea is if you can get rid of the main problem, the body can then fix itself. It's a really direct, powerful approach that you'll often see used for acute condition. But this is not just about throwing strong herbs at a problem. It's actually a very sophisticated two-phase strategy. A practitioner might use a strong attacking formula for a week or two, let's say to clear the intense heat from a bad skin condition. And then, after watching the patient really closely, they'll switch to a gentler formula to clean up and help the skin fully heal.
So what's the big takeaway here? Why is it so important to understand this ancient practice in our modern world?
It's actually pretty simple. By bringing these external formulas into the clinic,
practitioners can seriously broaden the overall effectiveness of Chinese medicine and, this is a big one, get faster relief for their patients, especially with stubborn stuff like skin conditions.
And this quote just says it all. Instead of only sticking to mild, long-term treatments, this more decisive action can bring a much quicker resolution. It allows practitioners to really exploit the true virtues of Chinese medicine in a way that just using internal treatments might not.
And that leaves us with a final thought. We've seen that there is this vast, powerful, historically rich side of TCM that goes so far beyond needles and teas. So the question is, what could happen if we really started to integrate it? Could this be the key to unlocking the full, true potential of this ancient medical system? Something to think about.